not really.
He's a reliable patient.
Okay, but
he's done multiple
For the purposes of
he did
this.
some math.
Okay. Yeah, he's got a step-up deformity on his shoulder where you can see the bone sticking out, so we know that he popped it out frontward, and we're going to try and put it back in place so that he'll stop. Yeah, he's having a lot of distress and pain about his shoulder, and it'll make it easier to get to the other patients.
great. And he did not have an MOI for spine, is that correct?
No, he did not.
Clear on his spine. Clear on his spine.
911 dispatcher, go ahead.
Yes, this is Bob. We have a multiple patient. Sorry about that.
This is dispatcher, go ahead. I read you.
Yes, this is Bob at near the Mackenzie Pond climbing area. We have multiple patients. We have a male MOI spine, unresponsive, bleeding, airway obstruction, has a pulse, require rapid evac. We have a female MOI spine, TBI, altered mental status with a head wound. We have an MOI for spine with amnesia, TBI for an evac. We have a male possible dislocation of a shoulder that they're treating on the scene. We have a knee injury that they're treating on the scene. They cleared the spine for that one. We have an ASR. We have a 20-year-old possible heat exhaustion. They're hydrating that patient. And we have a 40-year-old diabetic that's possible MOI for spine, and I have not heard back from that one yet.
Okay, copy that. So you've got a total of 8 patients. How many critical patients, and what resources do you want us to send you?
I have 3 critical, possibly 4 critical. I would need a helicopter evac and possible ambulance.
Okay, copy that. We can send you a helicopter that can transport 2 critical on backboards if you need them. They can get there in about, I'd say 30 to 40 minutes. We can send you an ambulance that can transport 2 more that'll get there in about an hour from now. You copy?
Copy.
Yes, she's been found, she's been taken care of. I believe there's 3 more.
So have you guys communicated like what your priorities are to your IC at this point? Josh, you were asking for the radio, so there you go. There you go.
Some of that pad too.
Mr. Bob? Go ahead, Josh. Hey, Bob, I need to know your location so I can carry my patient.
Okay, Trent, your patient's looking a lot better. Tell me what your problem list is for Maliki.
Heat exhaustion.
Okay, and what's your anticipated problem?
Anticipated problem would be dehydration.
So what's your anticipated problem?
Decompensated volume shock.
So how'd you treat the heat exhaustion?
We put a moist, cold rag on his head.
So cooled him down, anything else?
Gave him some water.
Excellent, so you're rehydrating him.
Mm-hmm.
So is the mental status improved? How'd you figure out it was heat exhaustion?
His blood pressure and his pulse and respirations were way up. His blood pressure seemed alright.
Okay.
His skin was pale, and he was kind of clammy and cold on the outside on his skin just because he was sweating quite a bit.
Mm-hmm.
And we kind of started getting some information out of him. He mentioned that he's been drinking quite a bit of Mountain Dew.
Okay.
Caffeine kind of dehydrates people.
Great. And did you ask him anything else? They told you that he was...
He's 20 years old.
No, I mean they told you it was heat exhaustion.
Oh yeah, we asked him.
Tell me that again.
I asked him if he'd been urinating a lot.
And what did he say?
He said he had, but he said the last time he urinated was an hour ago, and he said it smelled like olive.
Okay, so Kyle, your patient's looking a lot better. Tell me what your problem list is.
Our problem list was she was diabetic and had very low blood sugar.
Great. So what was your treatment?
Our treatment was we gave her. She had some lifesavers in her pocket. We knew those were safe because they're got that hole, so like even if she had potentially choked on it a little bit, that she'd still be able to.
So what'd you do for your patient?
We treated our patient first with this glucose.
Oh great, so she started responding to that, and then you did what?
We let her, and told her to take deep breaths, and then we eventually, when she became responsive and could function with us, we gave her a lifesaver, which gave her more candy or sugar.
Excellent.
Her pulse and
Okay, so Kyle, tell me again, how did you figure out that the stop eats problem was a diabetic problem?
Well, the other patient started to come to, and he informed us of her condition and what happened to her.
Yep, and then what happened?
And then, so we treated her for that, and she then started to potentially get a little better and slowly come more to, and as she got more to come to, then we were able to treat her better. And
she's told you more about her condition?
Yeah, we
okay.
asked her and we were able to.
So are you guys going to evac these patients?
We're not going to evac these patients. We're going to leave it to their decision of whether they want to leave or whether they want to stay, because it was not a serious injury or anything. It was just a temperature or low sugar level. So.
You going to evac your patient, Trent?
Mal, I think needs to rehydrate. I would evac him and get him rehydrated, but I think if I do, he's gonna go to the gas station, get a 2-liter bottle of Mountain Dew. Start
all right.
more of that.
Do these patients need carried out, or are you gonna walk them out?
They could be walked out.
Okay, we're getting the log on the right side. We're going over a
double log.
Oh, there it is.
All right, slow it out. All right, slow it. Is there any other secondaries that's not with a critical victim?
Hey, they need somebody to carry. Go.
You got your sunglasses, Heather? Real time? Real
like,
time? You have your...
You
got it, sweet. Okay. Heather, how you doing? How you doing, Heather? How you doing, Heather? Heather, you still doing good?
Brad, the other litter's right behind the front one.
Yep, right here. Yep, right here. All right, we need a roller. We need a roller.
To her right.
Oh, sweep. Okay, sweep. Check your vitals. Check your vitals.
All right, back on the horizontal.
It's gotta get up. It's on a stay over here. Lift it up a little. All right.
Okay.
Right, I'm gonna start.
Another
stump somewhere in the middle of the trail up here. You're gonna have to tell us when you want to tip. And let's tip it to the left. So tip it to the left.
911 dispatcher, do you have any update on your information, incident commander?
Yes, I do. We have 2 coming out on backboards that are strapped to the boards for evac by helicopter. And we had the other MOI for spine was actually a seizure.
Okay, so do you still have 4 critical patients that are on litters?
We'll check vitals when we get down to those boulders.
No, I have 2 that are on litters.
Guys, are eyes
Any other critical patients?
Can you talk to her?
No.
Oh, we can't put her down right
And you still have a total of 8 patients that are getting evac, is that correct?
Is she Z?
She was A minute ago.
Yes, that's correct.
Glad as we're gonna get.
Correct.
Head close it.
I'm letting the primary call everything.
Okay. All right. Is your airway okay for real? Okay.
Yeah, real time. Are you doing alright?
Okay, back and roll. Are you breathing?
Yeah.
You are?
Okay.
One list is we have a TBI that's late
Okay,
stages.
she's starting to vomit.
Call it.
Okay, I'm sweeping. Okay, she's clear.
TBI, we have an MOI for spine. We have altered consciousness. She's in and out of from A to V.
Okay. So just your problem list. So MI for spine, TBI, anything else?
ICP.
Yeah,
Due to the
ICP.
How do you know it's ICP?
Because persistent vomiting.
Okay,
headache.
great. Anything else wrong with your patient?
She's got a ankle there, but can't really see anything on it.
Anybody missing a
Okay, so it's stable or unstable?
It's
stable.
Michelle, you doing the calls?
We're gonna lift. 1, 2, 3, lift. And walk.
How are we doing, Jordan? Good.
Nice
bag. I don't care about that bag. Keep going.
Jordan, can you stop for a minute?
Yep. Here, Jordan.
Are you the primary for your patient?
I'm not.
Okay, do you have a problem list for this patient?
I have not a clue. All I know is he is feeling tired. Feeling tired.
Yeah.